The honor this evening of introducing Donna Smith, who is crisscrossing the United States. I talked to her earlier this evening, and she's going back to Boston tomorrow, or Baltimore tomorrow morning, very early, and then she's going to places like Cleveland, Detroit, and Los Angeles, and Minneapolis, I believe, and so she's constantly on the go promoting healthcare reform every week. But just to give you a brief synopsis of what Donna Smith is about, where she comes from. Donna is a Phi Beta Kappa graduate of Colorado College with a degree in history. Her journalism career includes work as a stringer for Newsweek magazine. She has been honored by the Associated Press managing editors with 15 regional awards from 2004 to 2006, and by the Inland Press Association's top honor in 2006 for community-based journalism. Since 2007, she has co-chaired the Progressive Democrats of America's National Healthcare, Not Warfare campaign, and she has so far spoken in 41 states and the District of Columbia about single-payer healthcare reform. Donna continues an active writing and speaking career, and now blogs and writes op-ed pieces about the healthcare crisis. She also is the founder of American Patients United, a nonprofit group educating citizens about the healthcare reform on the national level. She also works as a national single-payer healthcare advocate and community organizer for the California Nurses Association National Nurses Organizing Committee. Donna and her husband, Larry, now live in Washington, D.C., and they have 6 children and 14 grandchildren. I'm happy to present to you Donna Smith.
Thank you all very much, and thank you for coming. That, I will have to say, is the very first time anybody ever played The Girl from Ipanema before I came. All right, Bellingham. It just became my favorite city. It is a beautiful, beautiful city, Bellingham. It's the first time I've ever been here. It's the first time I've been this far north, I think, in the country, which is quite special for me. I've been to Seattle a couple of times, and Seattle's a beautiful city, but you've been so gracious to me here. Thank you so much to the folks who invited me and had me here. And thanks to the folks who spoke earlier, to Chris and to Jason and Eileen for setting up the moment for us and for giving us such good information going forward. I'm going to share with you a little slideshow, and this is what I do a little bit when I'm on the road. I need to update my bio a little. I now have added 43, I think I have 43 now states in the District of Columbia. The organization I work for, the California Nurses, now I see it as a sense of pride to try and round out the number, I think. So we now, in case you didn't know, how many of you know a little bit about the California Nurses Association? Heard a little about them? Wonderful. Well, just to give you a little update on them, they now have merged with the Massachusetts Nurses Association, United American Nurses. They are 156,000 nurses strong, all advocating for single-payer healthcare reform. And are all of you familiar with single-payer? Don't be shy. Is there anybody in the audience who does not know what single-payer is and would like a little explanation, brief, down, dirty? Thank you. I'll give you the quickest one I know. First of all, we have some good examples in this country. Medicare is a single-payer system. The VA system is a true single-payer system. The Indian Health Service is a single-payer system. Some that are not. S-CHIP is not a single-payer system, the Children's Health Insurance Program. The Federal Employee Benefit Plan is not a single-payer system. TRICARE for military personnel is not a single-payer system. And what we just got is not a single-payer system. Single-payer is a wonderful idea from the left, public financing, with a great idea from the right, which is private and public delivery, in one centrist position. It is not communist. It's not lefty liberal stuff. It's a centrist position for solving and giving health care to all of us. So that's my slowest and quickest pitch for single payer. How many of you already saw Sicko, so I don't have to go through a lot of those details? Terrific, great. I'm not going to go into great detail on things you already saw there. What you see before you is the Smith family, or some iteration of them. I don't think all 14, in fact, I know not all 14 grands were born at the time this picture was taken. But this is some of them, pretty average American family, I think. Both my husband and I have always worked. My husband doesn't now because he's disabled and retired. But we both worked, always carried health insurance, made it a priority to have health insurance. We did what many middle-class working families do. We'd take a look every year at what his benefit plan offered, what my benefit plan offered. We'd choose what was best for our family based not just on cost, but on what we really thought our needs would be going forward. As we got to the 1990s, deeper into the 90s, we saw what all of you are seeing, along with us, was this drift in our coverage to less things being covered, less adequately, higher copays, higher deductibles, higher out-of-pocket expenses generally, and higher premiums, so a higher cost for less coverage. So we weren't irresponsible through that process either. We bought an Aflac disability policy to cover what we thought could happen to us at some point, and we also had a small healthcare savings account. So we did what they said we should, right? We did. We're responsible. We're raised to be responsible. Now, mind you, with disability insurance, what many people don't know, unless you buy into it before you've had any health problems, they're going to do a similar underwriting process of any insurance carrier. They're not just going to look at you and say, oh, by the way, we'll cover every 50-year-old for every possible iteration. They're going to have a health questionnaire and ask you what's happening, and Aflac did that with us. So what they did for my husband, and many of you know our story, he's a tall, slender guy, very athletic, outdoorsy, but has lots of problems with his arteries, lots of bad genes for his arteries and his heart and all through his body. But guess what they excluded? We'll cover everything on Larry as long as it doesn't have anything to do with arteries for his disability insurance. So while I covered him in case something terrible other than artery stuff would happen, as you can imagine, they could equate almost anything to Larry's arteries. So there we were, American family just kind of going along. I was working as a newspaper editor in a small town newspaper in South Dakota, the Black Hills Pioneer, published out of Spearfish, South Dakota. I always tell people I was very proud of that background. I loved working for the Black Hills Pioneer. It was the longest publishing newspaper in western South Dakota. Our newspaper actually published Wild Bill Hickok's death on its front page on August 2nd, 1876. And I was so proud to be part of that history. And I was lucky enough to cover everything from church lady bake sales to Tom Daschle, who was our Senate Majority Leader at the time and also our senator from South Dakota. So that was one of the blessings of being an editor of a small town publication, is I got that kind of access to some wonderful leaders. And that was me in the newsroom. I really enjoyed the job very much. Larry and I did things like most families do, working families do. These are two of our grandkids, Bella and Reese, and in Southern California at the time. But Larry had kind of some brewing problems. He had his first serious heart attack, 46 years old, and heart bypass surgery shortly after that. Had another heart bypass shortly after that, about a year later, when his original artery reoccluded, which happens sometimes with people with heart problems. He later on would develop peripheral artery disease in his 50s, very young, so that his legs hurt a lot. He had what's called claudication. Some of you may have this problem, so you know what it feels like. It hurts, and you have to wait for your blood to restore in your limbs and so forth. So his career as a machinist was cut very short, and he started doing other things. He had worked so hard all of his life, but he started doing things like pizza delivery. He worked in casinos cashiering. He did stuff I never thought this proud and very talented guy would do, just to try and stay above water. And I worked inordinate numbers of hours, writing, picking up work, because what do middle-class families do when you get in trouble? You work, get another job, you find a way to survive, you hang on. You do everything.